we are talking about rising costs. Now, not rising costs in the grocery store, not rising costs at the gas station, but rising costs in hospitals. It was in the news this spring that hospitals in Louisiana are failing to be transparent with a 2019 executive order by then, believe it or not, President Trump, who ordered them to be transparent with their billing practices. To talk a little bit more about transparency in hospitals, we contacted health advocate Beth Pence.
I am a retired communications professional who spent many years in the healthcare field, in the healthcare profession. And this is something that is really important to me, especially now. And as we age, we see more conditions than we did, than I did actually 30 years ago. So I found out about this hospital transparency and the organization looking to bring awareness about it, and I just immediately had to jump on board.
Okay, all right. So what did Trump's order in 2019? What did it require them to do? And I guess if you've ever been in the hospital, and I have, I'm sure everybody we're speaking to has, I'm sure you have as well. You
Hmm.
get your bill and you look at the cost of a Band-Aid that might be $10 or $20, and you're like, okay, come on now. So I guess some of those issues led to bigger issues, which caused Trump in 2019 to bring this issue forward. Can you give us a little background on that?
Basically, the executive order requires hospitals to to be very transparent in their pricing, meaning they need to tell you up front what it's going to cost. Now, that being said, only about 15% of hospitals in Louisiana are actually doing that. And recently, there were several that had been fined, but I know of two this spring that were fined. The Community Care Hospital in New Orleans and North Lake Behavioral Health System in Mandeville. And they were fined for not being transparent in their pricing.
Now, don't you think that could be kind of shady?
Well, I think certainly when you're not transparent, you're hiding something. What are you hiding? A $10 Band-Aid? A $20 box of Kleenex? Come on.
And so what are they? What is the government doing right now to force them to be more transparent?
Well, again, I think a good beginning is having them look into it. It was the Centers for Medicare and Medicaid Services. They're the ones that issue the fines. So, you know, getting these fines, it's a good start, and they're just going to have to continue to look into these hospitals, these individual hospitals, and these systems to make them comply with the law.
Now, you know, I didn't know that we have rights when you go to the hospital. I didn't know that patients have rights. I heard coming up as a child, I heard my parents discuss their bill over the phone, and try and quiz whoever, or whatever situation had occurred. But do we have rights as a patient in a hospital?
Yes, you do. And there is a patient bill of rights, um, that, well, I'll say when I go to have, some kind of health procedure, and they have you sign, and they say, this is your bill of rights, sign here. But nobody hands me the bill of rights. I don't know what they are.
Okay.
Now, I know what they are because I looked it up.
Okay.
But in that situation, they just say, here, sign.